Okay, so tonight, we're trying to practice better social distancing, so we have our chairman of our Board of Health and our public health nurse, as well as town council, on video conference, so that we have less folks in town hall. We do also have some members of the public who have tuned in via this Zoom video conference, plus we have folks on HW Cam, so this is being recorded by both the Zoom video conference and by HW Cam, and they will wave. Can you guys wave? Can you hear me? Yep, there we go.
Jackie, introduce yourself, please.
Oh yes, Jackie Bresnahan, Special Projects Manager
For the town of
for
Wenham.
the town of Wenham.
Thank you.
Just moderating this Zoom, and now be over here. Please ignore me for the rest of the day.
This is all new to us, isn't it?
Very new.
So this is the trial run.
It's not true, John. This is the real,
Well, it's a real
we're
thing.
live
but
here.
it's-
But we're going to make it work.
All right. So welcome, everyone. Ordinarily, we welcome public input. Since the public is not invited, we're not going to have any public input. We have some announcements, and that I'm going to turn it back over to Jackie. You?
Yeah, Jack, you want to pop the slide?
Yep. This is. I can't make it bigger.
Okay. Just go to the next slide then.
Well, while she's trying to get
Oh,
the
she's
slide,
doing
let me
that.
just let everyone know that we're doing this virtually because to comply with Governor Baker's request that public meetings not be held, certainly with 25 or less, and the president wants it to be 10 or less, and so we're trying our best to minimize physical contact, both amongst ourselves. Ordinarily, you would see three of us up at this table right here, Catherine my left, John to my right, but we're at least 6 feet apart as recommended, and Catherine Tinsley is 10 feet apart. She's even more cautious than the rest, so that so we're doing this. We may have to stumble through this, but we're going to try to basically conduct a virtual Board of Selectmen meeting, and that if we're a little hesitant about how to do this, please bear with us, and that we're learning as we go along here. This was just brought to fruition today, and that we didn't have any practice sessions either. So turning back to Anthony and/or Jackie.
All right. So the first announcement, under announcements, the resident budget forum that the Finance Committee was holding tomorrow at 10 a.m. at the Senior Center, and again at 7 o'clock here at Town Hall. That is being postponed. We will have that up on the website, if it's not already up by at this point, and we will reschedule that for another day after we consult with the Finance and Advisory Committee. Next thing I just want to mention is a report. We put together a great 4-page document. Great job by Nikki, Jackie, and the team here at Town Hall that will be up on the website. I just want to read the first few paragraphs and go over a few important, some information that the public will, I believe, will find very helpful. It says, in light of the ever-evolving situation here in the Commonwealth, the difficult decision has been made to close all town buildings to the public effective Monday, March 16, 2020, until further notice. All town activities, programs are canceled as well. This decision is being made in an attempt to limit in-person contact while also continuing to provide basic services to residents and business owners. The town has also begun to take the necessary steps to cancel non-essential government meetings. While we certainly understand the situation is not ideal, we are proceeding with the well-being of our citizens and staff in mind. We encourage everyone to closely follow information from the Mass Department of Public Health, the Wenham Board of Health, and the CDC, and exercise good judgment and caution. And CDC stands for the Center for Disease Control. We are asking that the public to use our online resources for online payment and contact us via email and telephone with any questions that you may have for us. Essential business with the town requiring an in-person transaction must be conducted by appointment through each department. Residents are encouraged to use online services in the drop box outside of Town Hall for bill payment. Again, other business will be conducted by phone and email. And another thing we just want to mention is to take all the precautions necessary to stop the spread of this respiratory illness like the flu and COVID-19, such as washing your hands frequently for 20 seconds with soap and warm water, or use an alcohol-based sanitizer. If you're experiencing a fever or other respiratory illness and is concerned that you have either come in contact with the virus or traveled to an infected country within the last 14 days, advised to contact your primary healthcare provider. Clean and disinfect frequently touched surfaces daily. This includes doorknobs, light switches, countertops, handles, desks, etc. It's never too late to get the flu vaccine, and if you're home, please, if you're sick, please stay home. Prior to that decision, Mr. Chairman of the Board, we met for the past couple weeks as a team, and that team was the Wenham Board of Health, myself, our public safety team, as well as Hamilton's Board of Health, their administrator, their manager, their safety team, and also with the Hamilton-Wenham Regional School District, the superintendent and her leadership team. So this is something that we were preparing and discussing this outbreak a couple weeks ago, and then we met again last week and felt the need to escalate this and to do the closings. So with that, I'll turn the meeting back over to you for...
It was me. So
Can I sneak in one more announcement if you're going to move on from announcements?
just a minute. Let me
Sure,
just... Okay.
sure. No,
So,
it's fine.
right after what I'm about
Yeah.
to say. So, Anthony,
Yes.
you just read from this Town of Wenham COVID update, March 17th today. Is this on our website?
It's already up there? Yes.
Multiple places.
In multiple places. And so everything Anthony just read is up on our website, and there's a lot more. There's the telephone numbers of all of the major departments, in fact, all the departments, beginning with ASSs and right through. So if you want to contact any of the departments, as Anthony just mentioned, for a question, an email, whatever, or to make an appointment, the telephone numbers are up there, and they're up other places as well. So, Catherine.
Okay, on a different subject, but relative to the school district, a member of the school committee asked me if I'd pass on some information. Most people know that they're in the middle of a superintendent search, and of course, had many discussions about stopping that search sort of in the middle because of everything that's going on. However, there are a number, 3, 4 other districts that are also doing superintendent searches at the same time, some of the candidates overlap. So in order to not lose candidates, and because they had done most of the preliminary work, they are continuing with their process virtually through online sources. So they have named 4 finalists with the help of a screening committee. The 4 finalists, I'll just read their names and where they're from. Mary Beth Banos, who's superintendent of schools for the Windsor Central Supervisory Union in Woodstock, Vermont. Philip Conrad, who's the principal of the Andover High School. Julie Kuchenberger, who is the interim superintendent for our own school district here in Hamilton-Wenham. And Daniel Richards, who's the principal of Georgetown High School. What they really would like us to say tonight is that there are going to be Zoom online community forums so that the candidates can speak, and some questions can be asked. Those forums begin tomorrow night, Wednesday, with Mary Beth Banos, and Thursday with Julie Kuchenberger, and then continue next week. So all of the information on how to join that forum or ask a question is on their website, hwschools.net, but they just asked me to please pass on the fact that this is continuing. They're doing interviews, as well as these public forums, which will be done with Zoom, and also meeting with teachers. I believe, I guess I shouldn't say this, I believe they're hoping to make the decision as soon as possible, perhaps as early as the end of the week, but I don't know that for sure. So, yeah, John.
I have a question, Catherine. The name Phil Conrad rings a bell with me.
Yep.
Am I familiar with that from the Hamilton-Wenham school system?
Yes, he worked in the Hamilton-Wenham school system for, I want to say almost 10 years?
Back in the high school? I
In the
think?
high school, yeah.
Thank you. Okay. I know of one candidate there.
Yeah. So that's all I
Good.
have. Thank you for letting me.
Mr. Chairman, before we proceed, can I just ask that all members of the board speak up a little bit so our video conferencing guests
What?
can hear you?
I can hear. It was a joke.
But just so that the,
Is this on? That's
This is on, but this doesn't lead into the conference phone, so just so people on the video conference, our town council can hear you.
Okay.
Speak up a little.
Yep. How about now? Is that a good volume level?
Yeah, I think that's much better,
Okay.
Okay.
but that's everybody.
Everybody, not just me. Okay. Didn't pick. Sure. Introduce her.
Dr. Tang, I don't know if it's going to be you or Mary Beth that wants to just give an update.
It's actually Mary Beth Ting, who's the public health nurse, who's prepared these slides.
Okay.
And?
So just to give you a little update on where we are with coronavirus disease, we are having significant increase in the state of Massachusetts according to the DPH update that the local boards of health received today. So to start, this slide just shows you what the symptoms of the illness are, not dissimilar to flu, fever, cough, shortness of breath, considered lower respiratory illness. If most individuals will have mild to moderate illness that can be cared for successfully at home. However, high-risk individuals will need to identify themselves for care and seek care. Those would be people with underlying heart disease or respiratory disease, or individuals who are over the age of 60, or any other sort of immunocompromised condition. There's a lengthy list, and those are all available on the CDC. But those individuals need to seek care sooner rather than trying to ride it out at home, because their risk for serious complications from this infection are elevated. Next slide, Jackie. So from the DPH update that I was on today for the local boards of health, the case numbers in the Commonwealth are steadily rising. As of yesterday, we're up to 197 cases, which was up from 164 the day before. The key message right now for everyone here in Town Hall, everyone listening, everyone in our community is that social distancing is key. It is the one action that we can take and must take now. We need to slow the progression of the infection, slow the progression of new cases, because the risk that we face is that the needs for caring for individuals will far outstrip our capability to do so in our hospitals and our intensive care units. So the message today was we must all prepare for a longer period of intense social distancing so that we can buy time for our hospitals, our intensive care units, to meet the needs that are definitely coming our way. Lastly, I wanted to say who should be in self-quarantine right now. Many of the countries of Europe are now level 3 health threat countries. So if there are individuals who have returned from semester abroad, if we have college students home in town, they should be self-quarantining 14 days from when they left their country in Europe. Additionally, individuals who have had exposure to someone who's tested positive for COVID-19 should also be self-quarantining for 14 days. We have guidance from the Mass Department of Public Health and Centers for Disease Control and Prevention on what that means, and that's up on our Board of Health website. Please do feel free to call the Board of Health or email me for specific instructions if you need to self-quarantine. Jackie, am I okay? It says my internet connection is unstable. Am I doing all right?
We can hear you, it's just sometimes your face slows down. So keep on going.
Yeah. Okay, next slide, please. So just an update for you on the Board of Selectmen, what we have been doing over the past few weeks. We have been diligently participating in the conference calls from the Department of Public Health to the local Board of Health with advisories, with guidance, and we've used that guidance in consultation with Wenham town officials, in concert with our colleagues at the Hamilton Board of Health, and with the officials of the Hamilton-Wenham Regional School District. Using this guidance and our consultation with each other, we cooperated in making decisions about closing town hall to the public, closing the schools, and we are following guidance currently from the governor in the state of emergency around meetings and trying to do meetings virtually. As we discussed at the beginning of the meeting, trying to keep people at home away from each other while still trying to conduct business. We have been adding to the town website the Board of Health page with links to current information both from the DPH, CDC, and we continue to update that as more information.
Oops.
Mary Beth, we lost you volume-wise. Dr. Ting, can you hear us? Can you keep going?
Yeah, so the town webpage for the Board of Health has all the links to the current information, both from the Massachusetts Department of Public Health and the Centers for Disease Control, as well as I know that HWCAM is going to provide information to the public that's similar. We have been working with our colleagues at the Council of Aging, who have a list of individuals who are in our town that may require extra help, and that we are reaching out to them to make sure that they are in a safe area. Obviously, we don't want people visiting them per se, because that would actually provide a problem with bringing, not social distancing, but using phones and other means to make sure that they're okay. Now we've lost the slide, so I'm not sure what's next, but
It's what's moving forward. Sorry, we're reconnecting.
okay. So moving forward, we need to put into the finances for a better internet connection within Town Hall. I don't know.
Amen to that.
Good one.
All right, so that would be one of the proposals I would put for emergency preparedness, is having stable internet connection. So moving forward, what we're doing is, obviously things are very fluid, and so we are listening to the guidance from the Mass DPH, which sends out, in fact, my email is blowing up with a number of updates that the DPH has been given, and then obviously with the state and then the federal government about what's going on with better epidemiologic information, as well as looking into those individuals who may require testing. I think still our preventive guidelines continue the same, which are social distancing, continue to maintain good hygiene, and hopefully if we can wait this time period out, we'll see what everyone's been calling the flattening of the curve in terms of the number of new individuals infected, to see it to start to flatten out, and then at some point decline.
Dr.
I'm back.
I have a question
there you
for
are.
whoever, if that's possible. This is John Clemenzi, Board of...
Anything else, Beth?
I no longer see the slides. Did we do the last two slides?
We did.
We're on the end, so what's the last thing?
Jackie, do we have the slides anymore?
We do, but John had a quick question.
Oh, I can-
Get the slides back.
All right,
I don't hear Jackie.
Selectman Clemenzi has a question that he's going to ask.
can you hear me? Can you hear me?
So did we do the what Wenham residents can do?
Yes.
No, you're gonna finish it.
Okay. So what Wenham residents can do, we talked about it at the top of the meeting, practice prevention. First and foremost, stay home when you are sick. Do not be out and about. Stay home when you are sick. And remove yourself from the other members of your household so that you don't share any illness. That's good prevention for whether it's influenza or in this day and age of COVID-19.
Mary Beth.
That's 6 feet away from each other. That also means don't share play equipment, don't share hand towels at home, don't share eating utensils or plates. Everybody should be eating on their own plate with their own utensils. Frequent hand hygiene is good hand washing. 20 seconds of friction with foamy, soapy hands before rinsing. Avoid touching your eyes, nose, your mouth. disinfect the frequently touched surfaces, and to stay informed from reputable sources. That's the CDC and the DPH, as well as our Board of Health website. I think it's the last slide, Jackie.
I know, I've texted her, we can't hear.
Obviously, this is a work in progress.
Is that it? Is it?
I'll try again. Mary Beth, can you hear
Did we do
me?
the going forward? Andrew, did you already do that? Oh, here's social distancing. So, okay, this is the importance of social distancing. So this little infographic will be up, if it's not already, on the Board of Health website. This is really, really important information. It's what we can do right now, and this is the contact information for questions and concerns. And Andrew and I can take any questions and concerns right now if you have any you'd like to address.
Okay, ask your question. We'll see.
All right, are you hearing me at all? This is Clemenzi, Selectman Clemenzi?
No, so,
No, okay. My question is, if somebody can translate it.
Mary Beth, I think they can't
Let's
hear
go up
us.
to the podium. Stand
can't
next to
hear them.
Jackie,
No,
but
don't,
keep
they're
6
not gonna
feet.
hear anything, John's not gonna hear anything over here, it's on the call.
They have a few questions, Andrew.
Yeah.
John, what's your question? Well,
Okay,
maybe we can
the
help.
Just
question
ask
is-
the question and then we'll,
For the public to know, and myself, it's a
Jackie,
question-
can you not hear us at all?
no.
We can hear you, you can't hear
You
us.
can hear us.
You can't hear us.
Okay, I'm on by phone myself.
Andrew, can you hear us?
I can hear everyone. I think maybe Jackie is muted. I can see her phone. Yeah.
Yep,
That,
Jackie muted herself.
I'm not on mute, guys. I don't.
She never mutes herself.
Are you in the Zoom? Can you type it in the group chat box?
Yeah, I can. That's a good plan. Good idea. We're all learning how to use this,
Question
right?
So I can chat it to
My
them.
question is, our first responders...
I'm just texting her that she could read us the questions, and if they can hear us.
For the public's knowledge, our first responders have changed their policies, procedures, and
Correct.
protocols. How does that affect the public, and what should the public know about those changes?
So that's something I'd be happy to answer because we're doing the same thing for inspectional services. So anytime that there is a call where we are working with someone who is reporting symptoms similar to the ones Mary Beth just described, they are being vetted. So our dispatchers and all of our inspectional appointments, we're calling, we're asking a series of questions about the health of the folks that are there before we're having our staff go to those situations. And our fire department are not all going on to the same calls to ensure that they are not all going into the same house in case
I'm going to answer the question.
there was something that was going to be
All right.
passed.
I think I can answer that more comprehensively. Yesterday, Anthony and I met with the leadership of the police department and the fire department to understand that the priority is emergency responses, and that we wanted to make sure that certain for the police department, certain I won't say low-level activity, but that they were prepared to basically have their officers on duty completely attuned to any emergency response. The fire department a little bit
Jackie, still
different.
there?
Can anybody hear what I'm saying other than the people in front of me?
The people at
People at
home,
home.
Jack, you're still on HWCam on TV.
Okay.
So people at home can hear you.
That's good. So that the fire department is a lot more
Mary Beth,
comprehensive.
Can you hear me?
The fire department is a lot more comprehensive.
I can hear you.
We want to make sure
All
that
right, thank you.
we have the folks in the fire department that can respond. We understand that our backup ambulance service is overwhelmed with taking people to various hospitals, and that so we want to make sure we have the personnel and that their first priority and the second priority and third priority is emergency responses to people who are really need transportation to the hospital or any other serious condition. And so they have been come up with a plan to do that, and that was presented yesterday to Anthony and I. We're going to be monitoring that every 2 days or so over the next several days to make sure that anything that comes up that was not anticipated in this hour-plus long conversation can be addressed in a timely fashion, and our fire department and police department are attuned to have their resources all geared to emergency responses first and foremost, and secondarily lesser activities. And so there was lots of examples of lesser activities. I'm not going to go into them right now, particularly the police, but nevertheless, they're on board in that we understand the necessity of having people in the police and the fire department available to transport and to care for people who are in serious need of help for this coronavirus.
So, Jack, everyone who calls 911 will get a response and an ambulance if they need one, correct?
Right.
Okay.
We want to make sure that we have the personnel to do that.
Right.
The goal is not to really, if you're having symptoms, not to necessarily call 911. We really want that reserved for those important cases. Not that they're not important, but certainly speak to your physician. There's telemedicine that you can do, but really want to limit it to the really emergency calls.
Okay.
Yep.
But it's very difficult to instruct people what's what various people think is an emergency is different for every person. If they think it's an emergency, it's an emergency. So that.
Right. I just didn't want to
Well,
give people the impression
Jackie, can you hear me?
Well, this is.
Mary Beth, you just have to ask Jack if you want to be recognized. We can hear you.
Okay, Jack, may I be recognized?
Of course. Sure.
So what I would say is, in response to the question about calling 911, so 911 in relative to COVID-19 would be significant difficulty breathing, requires emergency care. I understand that everybody's nervous and anxious. Most calls can be handled by a call to the physician. Just like, there are some people who have emergencies around influenza, and that's usually around pneumonia and difficulty with breathing. So your average healthy individual will have, moderate to minimal symptoms that can be managed at home with things like Tylenol and hydration and rest and supportive measures. But those with underlying conditions, or if the symptoms are progressing such that the individual is having difficulty breathing, then that's the time for a 911 call. But, you start with your local primary care provider, call them and let them know what's happening. And, if they want to see you and you have exposure, or you're concerned that it's COVID-19, they will know the questions to ask you and direct you where to go, whether it's to calling 911 or whether it's coming in to be seen. Andrew, would you have anything to add to that?
I guess not.
Oh, we can't hear him.
Yeah, he's
muted,
saying
Jackie.
something, yeah.
Yeah, he's muted. I'm not doing anything. You guys are muting yourselves.
Well, I'm on the phone,
Oh,
so
we can hear you now.
can you hear me now?
Yep.
Yes.
No.
Nope.
All right. Okay, here we go. So I think Jack's question was that normal citizens of Wenham may or may not be able to determine for themselves what emergency is, and will call 911 even though it may not be a true emergency. So our safety personnel need to obviously take more precaution for the calls that they make, and whether or not they show up with personal protection equipment already available before they attend to the patient. I don't know what the protocol that the fire department is going to have. I'm sure they're going to ask those questions about the same questions we saw before about do they have a cough, fever, shortness of breath, so that they would have a better sense of when they come to a 911 call, whether they should be using PPE. Obviously, if it's fallen down the stairs and I can't get up, that may not need a full PPE, but I think other calls that do have cough, fever, shortness of breath, they should probably be on the safer side and use it if they have it, which is always the question of how much personal protection equipment does the fire department EMTs have.
Well, our fire department and police are not trained medical personnel, so therefore Anthony and I want to make sure we have the available resources to respond to 911 calls. And in certain circumstances, for example, the fire department, the police department, particularly the fire department, does get calls, gee, so-and-so can't get out of their chair. Would someone come down and help so-and-so get out of their chair for an elderly person? Well, they're going to have to wait and stay in the chair for a while, and that we're not going to respond in a timely fashion to some of those calls like that. I don't want to use other examples, but nevertheless, we were given examples that weren't of an emergency situation. And so the fire department is being advised to make sure your resources are geared towards responding to emergency situations. An emergency situation is defined by the person calling in, as opposed to, hopefully they've called their physician or other medical personnel, but our fire department is not trained to ask a lot of questions, nor I think should they. And if someone is presenting in their mind an emergency situation, we need to be able to have the resources to respond, and that's what Anthony and I are worried about, as opposed to making sure we have a triage set to go through. Have you done this? Have you done that? And da-da-da-da-da-da. We want to make sure we have the personnel, because our fire department is a volunteer call fire department, and we only have 3 people who are full-time, and so we want to make sure that we have the resources to respond to true emergencies, and that was kind of the basis of my remarks a few minutes ago. And we're going to be monitoring what types of emergency calls they do receive and get feedback, so we might be able to tinker and tailor with this a little bit in subsequent instructions to the fire department and the general public. But right now, it's making sure we have the resources available. And I think we were convinced that we do.
So just to be sure that I understand, when someone calls 911, they're not calling our fire department. They're calling dispatch. So I presume that dispatch does have some kind of a protocol.
They have a list of questions that they do ask.
Okay.
Yes.
And
depending on what they're being called.
And they're going to help us prioritize the non-emergency versus this is someone who's really sick who needs an emergency.
Well, but the example I gave a minute ago, an elderly person can't get out of their chair, and the caregiver wants the fire department to come to help them get out of the chair, that's not going to be classified as an emergency.
And dispatch is going to make that decision?
No, the fire department is.
Okay.
They're going to postpone the response, and because we're asking them to use their brains to figure out is an emergency or not, because they have been responding to those types of calls in the past. And
right.
we're telling them, if you respond to that call, you're not available for some other call that might be a true emergency.
Sure, that makes sense.
We're asking them to use their judgment about what they believe as an emergency, and they all have certain training that would allow them to hopefully make that decision.
So there are some calls that dispatch may call in that our fire department may decide to respond to differently than others.
Yes.
And dispatch and the fire department are both clear on that. That's the concern. Time is always of the essence. So if dispatch and the fire department are trying to figure out what each other is doing, that could take some valuable time. That's the only reason I asked the question.
Well, hopefully they're not calling 911 just for getting out of a chair. But nevertheless, I think they're being called our fire department. I don't know.
Okay. I'll just raise the point. It'll get addressed eventually.
Again, if they're out there helping someone to get out of a chair, they're not around to, we only have so many people in the fire department. For a life-threatening emergency situation. So, we're winging it here, but, we're trying to go back with them every couple of days to find out, okay, what types of calls are you getting, and which ones are you delaying or whatever, and which ones are you responding to, and do you have enough people? What kind of resources do you need, if any? And I think that they're all on board with that, and I won't go over what the police have less serious manpower issues since they have reserve officers on, 24/7, and that, anyway.
Well, I think that's the key, Jack, what you said. We're only as good as we have the men and women to respond to these calls. So, once they become, like Jack had mentioned, that the backup ambulance company, I believe it's Atlantic, has 8 cases. We received some correspondence from another community that has 20% of their police force that already have to be quarantined. So what we want to try to do is, we want our public safety to practice social distancing as well, but they also have a responsibility to for public safety and to respond to emergencies. So, and yes, we have mutual aid. But mutual aid is only as good as it can be received. If another community, if our staff goes down and we're not able to respond because we just don't have the manpower, so that's why we're trying to limit, as Jack said, some of those really calls that are not life-threatening in nature, but maybe another way to seek the assistance that they need.
That was the
Anthony's
purpose
going to
of my-
monitor this, and so we'll get feedback. Anthony's going to monitor this with the fire and police departments, and we'll see what, it's not black
Yeah,
and
we're going
white.
to daily briefings, daily morning briefings with public safety, our public safety team. So we'll monitor, like Jack said, what's going on, and then we're going to have to adjust on the fly with some of this stuff.
Yeah, and
Okay.
that was the purpose of my question, was so that the public had some idea of the protocols that used to be in force and now may be altered because you need to somewhat qualify. You don't put the first line out there for a non-emergency, non-life-threatening issue. Okay, so
We're
thanks.
just doing the best we
Thank you,
can
Jack.
to have the resources to respond to true emergencies, and anyway.
Yeah.
Good.
Are we done with that?
Anything else?
Yes,
Mary
no?
Beth, Dr. Ting, all set?
Read the Globe. It's a great source of information, by the way, in addition to the town.
CDC, DPH.
Huh?
I'd go with the CDC and the DPH myself,
Yeah.
rather than the
Want to hear
Globe.
what Charlie Baker is telling us not to do, you better go to the Globe.
Well, yeah.
One last thing I want to mention too, Mr. Chairman, is we had a working house fire last night,
Yeah.
early in the morning. And our fire department did really an outstanding job. First of all, they were at the scene at 4 minutes, within 4 minutes, which is incredible. The fire started in a garage, and they were it pretty much destroyed the garage, but they really stopped the fire by attacking it from the inside. They stopped the fire from really going through the rest of the house. So great stop by our firefighters. I just want to mention the great work that they did.
I was very impressed with that, since my house is 1 minute from theirs, and that means they can hit my house in 3 minutes if I have a problem.
And we all heard the
I was
sirens
very
going by.
relieved to hear there was a 4-minute drill. Not that I hope I ever need it. Okay, consent agenda. That's you, John.
Okay, okay, consent agenda. Meeting minutes, open, for the open session dated December 10th, 2019, January 7th, AM 2020, January 7th, 7 p.m., I'm sorry, January 7th, is that 7 p.m.? That's 7 p.m.
PMs. We had an
okay.
AM and a PM meeting.
Oh, I see, okay, so PM 2020, February 10th, 2020, and February 11th, 2020. An executive session February 11th, 2020. I move the Board of Selectmen vote to approve all items in this consent agenda,
As read.
including as read.
Second.
Thank you.
Are we releasing or holding the executive session minutes?
We're holding them.
Holding.
Okay.
Yep.
So that's February 11th executive session to hold. Approve and hold? Okay.
Yes.
Okay, ready to vote?
I said second.
Okay.
John?
Those in favor?
Aye.
Aye. Thank you.
That's it.
Okay,
That's it,
move the Board of Selectmen vote to approve all items in the, wait a minute, is that the same thing?
No, that's it. We're on the next
Yeah.
slide.
Okay,
Sorry, I'm trying to.
You can stand down, John. Oh, you're on
Okay.
the appointment.
Catherine.
Okay.
Catherine's on the
Appointments.
appointments.
Okay, so we have three appointments this evening. The first one is for Anthony Fahiri as interim town moderator. I'm going to probably ask for some backup on this. Oh, here we go.
Oh, yeah.
In December, I knew this part. The board became aware that our town moderator this is
the history.
the history. So a few years ago, as we all remember, town moderator Phil Weaver resigned because he was moving. February, a few months later, the board announced the resignation and developed the following process for handling the next town meeting, which was to request letters of interest from registered voters, and that interested parties would not be a candidate for election, and interested parties must participate in preparatory meetings prior to town meeting. The appointed interim moderator is introduced at town meeting along with the explanation of the process used.
Just continues. Next slide.
Yeah. So I think this is just talking about the interim town moderator appointment process, which we find ourselves in need of at the moment, since our town moderator Trudy Reed has resigned, and we would like to announce that due to the absence, wait a minute.
No,
So
this is-
at the town, this is the last time.
Yes.
This is at the 2016 town meeting. At the town meeting, the town clerk announced that due to the absence of a moderator, the first order of business was the election of a temporary moderator. Announced at that time that Anthony Fahiri had offered his services, was appointed as interim town moderator by the Board of Selectmen, and asked for Anthony Fahiri to be nominated, requesting a second. Also asked for any nominations from the floor, obtained a motion that nominations be closed, asked for a second, and took a vote to declare the same. And then conducted a vote by asking the chairman of the Board of Selectmen to cast the sole vote and declare the results. So that declared the person elected as temporary moderator, administer the oath of office, and immediately make a record of the proceedings. So that's what happened in 2016 when Paul Weaver retired. We're in a similar situation in that our present town moderator, Trudy Reed, has tendered her resignation. And as a Board of Selectmen, we have solicited the help of Anthony Fahiri again. He did such a good job last time. He has agreed to serve as interim town moderator for the 2020 annual town meeting, subject to those restrictions, and also subject to the fact that the Board of Selectmen would have to appoint him, and I presume the same things would have to happen at town meeting as happened in 2016. Good enough? Can I make the motion? Okay. So I move that the Board of Selectmen appoint Anthony M. Fahiri as interim town moderator for the 2020 annual town meeting.
Second.
Further discussion, questions?
I have a comment. I would first of all like to thank Trudy Reed for her service over the last couple of years as town moderator. It's not an easy job to do, and when you follow in the footsteps of somebody who'd been there for 40 years, it was daunting, I'm sure, in some ways. So thank you, Trudy. Secondly, I'd like to thank Anthony Fahiri for stepping up to the plate for the second time to cover us as interim town moderator. So that's my comment.
Okay.
All in favor?
Aye.
I do have a comment that this is not going to be the end of it, because we'll have the same problem for the 2021 annual town meeting.
Right, because it's going to happen before the election.
Right.
Right.
And it's possible we could have a special town meeting sometime between now and the annual town meeting and then. So that, but this is only for the 2020 annual town meeting. I'm just saying that we will not have a permanent elected moderator for the 2021 meeting, and we have not approached Anthony to find out, Tony Fahiri, to find out whether he's willing to do that or not, but nevertheless, this gets us by in the immediate future. We're just letting people know that we have a problem next year as well.
Okay, the second one is the inspector of buildings. When I first read this, I thought I was having a deja vu, because we had already, I thought, appointed Angelo Salamone, but as it says here, per our zoning bylaw, section 13.1.1, the annual appointment of the building inspector occurs in March and is for a one-year appointment. Angelo Salamone was hired and appointed by the board on September 17th, 2019, with the term beginning on September 30th, 2019 through March 31st, 2020, which is getting close. So the motion is that the Board of Selectmen appoint Angelo Salamone as Inspector of Buildings for a term beginning April 1, 2020 and ending March 31, 2021. Discussion?
No middle initial.
I guess
Second?
it doesn't look like there is one.
P.
P. No further discussion?
No further
Okay,
discussion.
so all in favor?
Aye.
So
Now,
that-
did we vote the prior motion you did?
Yeah.
Yes, we did.
Oh, we did,
It was
okay.
unanimous, I believe, for Tony Fahiri.
Okay.
Oh, yeah. Yes, we
Okay.
did. We can check with the recording secretary there.
Did we vote? I was pretty sure we did.
Otherwise, I'm
I
totally
thought so. I
senile,
just-
because I know we voted anyway.
We moved
Well, it
along
would
quickly.
not be hard to get confused on this. Okay, so the next one, if I may, takes just a tiny bit of background. So before I make the motion, I just want to give a little background to the fact that About 5 years ago, maybe 6 years ago now, we commissioned a study by the Collins Center to produce a wage and classification table for all of our non-union employees. And that did a few things for us. It listed everyone with their market rate sort of salaries and also in groupings based on their sort of the level of complexity of their job and a bunch of other things. Since that time, I think as happens with most of these documents, some things have changed. Some jobs have changed, some people have left and been replaced by other people, and some people have just been recognized for not for the fact that the job that they're presently doing doesn't fit in the context of where they were originally placed. And that's what we're, I think, talking about tonight. So we have presently permitting coordinator and special projects manager who over the last 4 or 5 years, whose role has expanded significantly, not only within the permitting, but in particular within special projects, and in particular lately within the budget. And so this is a motion that actually brings Jackie Bresnahan, its name's on there, so it's no reason not to say it, into the, I've forgotten what it's called, group? No. Into the column, into the proposed grade and salary that her present job actually fits. So that's the background for this particular motion. And the motion is...
Sorry, Zoom is killing me with the internet.
Yeah.
Make your next meeting, maybe.
Jackie, what, I guess, Jacqueline R. Bresnahan. We'll get that motion.
I guess we're not going to get an A+.
I probably have it. It's,
Guess not.
No, one vote is like
it hasn't changed, has it? I think this is
Yeah, that motion should be.
7377599. Okay. So I move that the Board of Selectmen approve the Director of new title, Director of Administrative Services job description, which is we've seen, and appoint Jacqueline Bresnahan to said position at a grade 6 of the town's compensation and classification system with an annual salary of $73,775.99, effective March 17th, 2020.
No initial, please.
I'm sorry, what did I say? R. Jacqueline R. Bresnahan. I circled it and then I didn't say it. I will only comment, I gave the background, and I leave it to anyone else if there are any comments. No. Okay. I guess it would be fair to say, I think, that it's a good time, I guess, to thank Jackie for the incredible amount of increased responsibility, not just tasks, but responsibility that she's taken on over the last 5 years. And I personally am happy to be able to compensate her and put her in a position, a market rate position and an equity position where she actually belongs relative to the tasks that she has and the new job description that's in our packet. So.
You made the motion, I'll second that.
Okay, if there's no further discussion, all in favor?
Aye.
Aye. That would be unanimous.
Yep. Congratulations, Jackie.
Yeah. Congratulations.
The way this was flithering in and out, I wasn't sure of my vote, though, but, until the very end.
Oh, what did you
Again, I
put?
think the internet is a
Oh, no.
good point.
Well, you can fix that next
Okay.
week then, right?
But I do want to thank you
I'll
all.
go back.
I really appreciate it.
You're
welcome.
welcome.
Dr. Ting will agree with
So I read, because I couldn't see this motion, I read the motion that was in my packet, which has an incorrect term. So if I can make a friendly motion and we can vote amendment and we can vote again, this annual salary is effective February 25th, 2020. Everything else, I believe, is the same.
That was from the last executive session meeting.
Okay.
When we can-
Yeah, and so I thought I had the up-to-date, so.
Second.
And all in favor?
Aye.
An amended motion, thank you. Now I think we have it right.
All right. New business. This is a real easy one for me. We're just going to pass over it.
My kind of thing.
So I'll tell you what we're passing over, but we had on the agenda the public hearing on equal employment opportunity and discrimination, including sexual harassment policy,
Oh, hi, Jen.
Okay.
What did I say? Was there something I said?
Oh, it's Jim Reynolds from our COA.
Well, anyway,
I'm muting him.
yeah, please.
There now.
We've got quite a crowd happening now.
Electronic Communications and Information Technology Policy and Family and Medical Leave Act, and that this is supposed to be a public hearing. I've had 3 complaints that since public is not invited to this, that these 3 individuals, which I was surprised that there was such an interest in this, suggested that it be delayed and postponed until we can actually have people, whenever that is, attending and can possibly offer comments. So we're passing over this because we can't hold a public hearing with no public here, other than us insiders. So let's see. Next, we have the engineering contract. That's you again, Catherine.
Oh, okay. So I'm going to quickly pass this to Anthony, but it is a motion. I'll make the motion, I guess, and then you can explain it. Move that the Board of Selectmen approve the contract with Weston and Sampson. I should be reading it here.
I'm getting it for you. I'm sorry, Catherine. Here it is.
Move that the Board of Selectmen authorize the town administrator to execute the contract with Weston and Sampson for a Longfellow Road Improvement Project engineering services in the amount of $94,300. Is there a second?
Second.
And maybe, Anthony, you can elaborate a little. This shouldn't be completely unfamiliar.
Yeah, so.
I hope not.
So this is the contract with Weston and Sampson to do the engineering and design right up through the bid documents to get those contractors on board. So this is a great start. I know it's something that it lost its way a little bit with Peter leaving and an interim and then me onboarding, but it was something that we were working on in the background to try to make happen so we can get this in the construction season this year. So next, we're working with the council on betterments and our accounting, and the treasurer's working on the borrowing. So this is the first step, is getting this contract so we can proceed.
Okay, and you feel as if things go smoothly, even with this, everything swirling around, this is still possible to start during this construction system? I don't want to raise anyone's expectations. I think it was pre-pandemic.
We can't promise anything. Just in Boston, Marty Walsh stopped all construction projects. So this was in the works before this all started. Everything's changed now, and it's rapidly changing every day. So we're going to do our best, but we can't make any guarantees.
Right. But once we have the signed contract, when the conditions are right, they can.
I'm going to execute that tomorrow. They can
job.
start right away. They're already itching to go. So.
Okay. All right. Any further comments? If not, we'll take a vote. All in favor of this contract? Actually allowing Anthony to execute the contract. Yes, that was unanimous.
Okay. Excellent. So now on to F. So the rest of mine.
Are we? Did we? Whoop.
We're there. Sorry.
Are we skipping over? Are we postponing E?
Yes.
Okay.
Yep, we need more time on that. I had a long
Okay.
talk with Anthony today about it.
Okay.
I'm
It
sorry,
was on here and I just didn't know.
That we were hoping, let me elaborate on that. We were hoping to have a meeting this morning of the Wenham Veterans Committee to get there, have a dialogue about it and find out how they felt, and that, but, it's no public no public meetings, and so that's delayed. So I think that time is not of the essence of this, and that there are other options, and hopefully if the Veterans Committee can't meet for the next 2 or 3 months, we're gonna continue on as what we're doing right now, but we'll see. And that there's a lot of
We're essentially okay for now.
we're okay for now, and that this COVID-19 virus has put a crimp in the dialogue amongst towns and what our options are and how the Veterans Committee feels about it. So we're not prepared to, I'm not prepared to go forward without a vibrant discussion of the Veterans Committee and how they feel about the various options that Anthony has presented to them, and that they haven't deliberated on.
But we are covered through this fiscal year.
We are covered, right.
Okay, so just so that I'm clear, because it's a little unclear to me how our Veterans Committee overlaps with Veteran Services. So it's very important that we through you, get the input and ask the opinion of our veterans,
Committee.
of the town Veterans Committee. But the decision, whether or not to, whatever to do, really rests with the Board of Selectmen
Correct.
and the,
No, just the
Just the Board of Selectmen.
That's it.
right, okay.
Yeah.
Okay, I just wanted to make
And
sure.
we've
I
already
knew
had
what
one
that was.
discussion on this, and
Okay.
there was lots of questions that couldn't be adequately answered at the time. This is maybe 6 weeks ago, and the Veterans Committee had a lot of questions, and
Sure.
at that time, they voted to delay any recommendation or action based upon significant concerns and questions they had, which have yet to be answered, and that it's a moving target, so we'll
Okay.
have to wait. And
Okay.
it's not, we're not going to suffer by waiting on that. on
Okay.
this. It's not clear which option we should choose either. All right, I'm sorry, I didn't mention that. Actually, it was John's thing. John, you sorry you didn't mention that? Yes, he is, okay.
Yes, that's
Yeah.
fine. You did fine, Jack.
Okay, I've got a declaration of emergency here, someplace to read.
Oh, yes.
Did I give that back to you, or?
I don't know, but
You're
I've
gonna
got
read the
one
whole
here if you
thing,
want
Jack?
it.
Yeah, let me have it, please, thanks. I thought I got this from somebody, but, all right.
High technology.
I've been working on
wouldn't
this
be
for 3
touching it.
days. Just kidding. I was handed to me this,
I was going to say, really, come on, Jack.
I was going to, listen, come on, you know.
He wouldn't have.
All right, we have a lot of whereases, and you know that some lawyer got involved in this thing when you start off whereas. This is the Town of Wenham Declaration of Emergency. We're not joking about this, but whereas as I was. Whereas the 219 novel coronavirus, this is 2020. Was it really
It started in 2019, though, didn't it?
in China?
Officially in China
fall? Okay.
in December.
I thought it was
Maybe
okay.
that's why it's called that.
It's a highly contagious and potentially fatal respiratory disease, the prevalence of which is increasing rapidly throughout the world, inclusive of the United States and the Commonwealth of Massachusetts. And whereas on March 11, 2020, the World Health Organization designated COVID-19 outbreak as a pandemic health emergency. And whereas on March 10th, the governor of the Commonwealth of Massachusetts issued a declaration of a state of emergency to respond to COVID-19 as. Whereas on March 13th, easy now, 2020, the President of the United States announced a national declaration of emergency. And we're on our fifth whereas here. Whereas on March, easy now, please. Whereas on March 15, 2020, Governor Baker announced emergency actions to respond to the evolving COVID-19 public health emergency impacting the Commonwealth, including prohibitions on public gatherings of 25 or more people, and prohibiting on-premise consumption of food and drink at bars and restaurants. From March 17th, today, St. Patrick's Day, I just added that in there, and April 6, 2020, as well as the suspension of elementary and secondary school education operations from March 17th of this year until April 6th of this year. Whereas the Board of Selectmen of the Town of Wenham and its Board of Health, in consultation with the State Department of Public Health, has determined that COVID-19 presents a major disaster which poses an immediate threat to public health, safety, and general welfare of people regarding both within and outside of Wenham. And whereas the Board of Selectmen of the Town of Wenham and its Board of Health have determined that immediate public action is needed in order to prevent or minimize the spread of COVID-19 by and among the people of Wenham. And I'm getting to the end of this soon. Whereas it is critical to take additional steps to prepare for and respond to and mitigate the spread of COVID-19 to protect the health and welfare of people of Wenham. And whereas declaring a state of emergency will facilitate and expedite the use of resources to protect persons from the impacts of COVID-19, including, but not limited to, emergency expenditures pursuant to Massachusetts General Laws, Chapter 44, Section 31, and limitations on ongoing hours and access to public buildings. And, page 2. Whereas the Board of Selectmen of the Town of Wenham and the Wenham Board of Health recommend that a state of emergency be declared in and for the Town of Wenham. Now therefore, excuse me, we, the Board of Selectmen of the Town of Wenham and the Board of Health of Wenham, Massachusetts, hereby declare that as of March 17, 2020, a state of emergency exists in the Town of Wenham. This declaration of emergency shall remain in effect until further notice is given pursuant to our judgment and the conditions leading to this deterioration, leading to this declaration judgment that the conditions leading to this declaration no longer exists. That's a motion.
Is that a motion, or do we need a separate motion?
We need
Is that good enough for a motion, Lauren?
Yes, it is.
Okay.
Okay.
Good.
I am
So
not going to read the whereases again.
No. So does it require a second?
Yes, it does.
Okay, I'll second it.
Further discussion. Anybody have another whereas I didn't mention?
No.
All right, all in favor?
Aye.
I think this is important. Anthony, this is Anthony's idea. We should congratulate him on that, or blame him, or whatever you want to do.
Can I just, because I don't want to forget this later, and you just mentioned Anthony's name, again, I think it's an appropriate time to acknowledge and thank Anthony for the leadership that he's taken in coordinating all of these things, in addition to the declaration of emergency, in the past few weeks relative to the town's actions and other towns' actions. So I just wanted to make sure we thanked Anthony for the extraordinary leadership he's shown in pulling this together.
Thank you, Anthony.
Okay,
John?
sorry, didn't
Yes,
want to
absolutely.
That's 3
interrupt.
thank yous.
Yes.
Unanimous, thank you.
Okay, going on. Discussion and potential vote to delay the annual town meeting. I think this is a no-brainer.
I just think, add on this one. So, because the town meeting warrant hasn't posted, the Board of Selectmen, it falls within your peer review under Mass General Law, Chapter 39, Section 9. Lauren, correct me if I'm wrong, but right now that allows the selectmen to postpone that date as long as the meeting's held before June 30th. Correct, Lauren? Right now, until the governor has declared something differently.
He's going to declare something
Oh,
different.
right, let's just confirm, so the warrant has not been posted, is that correct?
That's correct.
Yes, as long as the warrant has not been posted, then Chapter 39, Section 9 allows the Board of Selectmen to delay the date of the annual town meeting to any date that it deems appropriate, as long as the meeting's held by June 30th, and unless the governor's legislation addresses this issue further.
I believe it will. So I'm proposing, making a motion that we delay the annual town meeting to a date that we will declare later on. I think it's premature to actually select a date right now. I had a date in mind 3 or 4 days ago, which would have been May 2nd, which is the first Saturday in May, which is what we used to do up to 2011 or 10. But after reading everything I've read in the paper the last 3 days, that looks very ambitious and unrealistic. So I don't want to have people pencil that in and do it so that that would also include the warrant hearing as well, which is the previous Monday before the Saturday meeting. So I postpone to a date that we will select in the future, at a future meeting, not today.
And in accordance with MGL Chapter 39, Section 9.
Correct.
I'll second that.
All set.
All in favor? Aye.
Aye.
Discussion on potential vote to delay the annual town election. Similarly, and I think that there was some confusion whether there's a bylaw on this or not. There is no bylaw on this, and that we used to have our annual town elections, as all 3 of us selectmen know, from 8 o'clock to noontime on the day of the town meeting. And then we'd have a lunch, still provided by the WVIS, and then we would have the town meeting. And so that we've changed it to accommodate the bylaw that Hamilton came up with, and that so to have the mostly for the Hamilton Wenham Regional School District and the Joint Library, where the votes would all be announced at the same time. But for right now, I think that we, for the same reasons, we can't discern a definitive date now of the town elections. We need to postpone the town elections to some date in the future that's not, it's uncertain right now, but we'll have to solidify that in the future, depending upon Governor Baker's subsequent announcements about, there's a lot of things coming in the press about making it beyond June 30th and so on and so forth, and that obviously it's premature to have the town elections now, and that particularly since Hamilton's not going to have them for a while either. So that
Right.
the vote is to postpone the town elections until some future date, which the Board of Selectmen need to decide at a future meeting. And that's my motion.
I don't think it's hard to agree with that, with everything in flux. It seems like the only thing I would say is I think that our in the future, when this is decided, I think the notion of if we have a town meeting on a Saturday, the election on the following Thursday, whatever that Saturday and Thursday, will just give some familiarity to people. But yeah, clearly we're not going to be ready to do that.
Right.
So,
second?
yeah.
Mr. Chairman?
Yep.
If I may, thank you. I wanted to just update you that I do understand that special legislation has been at least introduced to allow towns that are holding elections within the next essentially month and a half to be able to delay the date of their annual town elections. And in that legislation, there's language that's very similar to language that we worked on, that if the legislation isn't passed, we would ask you to vote to authorize special legislation to address things like use of the same ballot so that we don't waste any municipal resources and other types of things like that. So this is something that I think will have a clearer vision of how it will work as we move towards the next month.
Yeah. But I think I'm correct in saying that even without that legislation, the Board of Selectmen have the authority right now to delay the town election. There's no bylaw that requires us to have it on the day it's already was selected to be. Right? Lauren?
So, of course, I want to agree with you.
Thank you. Anything else you want to say?
Nice try.
Basically, once an election has been scheduled, it's harder than it would be to move a town meeting. And so, although you don't have a bylaw that says the date on which the election has to be held, you've been proceeding with kind of that date in mind. And so all sorts of related deadlines are impacted when there's a delay. So I think that the governor's legislation is going to deal with this just fine. I don't think that the town, would typically undertake anything like this. And, for that reason, the board has adopted a declaration of emergency. We have state and national states of emergency declared. And I know that the reason that Wenham would be considering this in the first place is essentially to ensure that voters don't have to choose between coming out to vote or protecting themselves and practicing social distancing. So I think this is the best step for now. And as I said, I think we'll see what happens on the state level as to the delay and how to handle certain aspects of it. Otherwise, I have a draft special act ready to go, and we can ask the governor to file it on the town's behalf.
Okay.
Thank you, Lauren.
I'm a little confused. We've set a date for this election, and you're saying that the governor may put some legislation through to do something different?
Mr. Chairman, if I may.
Yeah, please.
Okay. Jim, so the deal here is that so you're setting this date, but again, because the date of the annual town meeting is theoretical at this point, so is the date of the town election.
Yes.
I think it demonstrates the board's intent and certainly would make sense. One of the issues that we have with respect to the difference time for notice of a town election and a town meeting. So with a town meeting, in theory, and I'm not suggesting this is what the board would do here, but in theory, there's only a 7-day notice requirement. So you post a warrant and you can have the meeting 7 days later. With an election where there's going to be candidates on the ballot, the process starts 64 days prior to the date of the election. So us shifting the election means that we have to deal with some also shifted deadlines. And again, I think there will be no issue with this. I think the legislation that's going to be filed by the governor is going to do that. It's going to likely require that 20 days notice be given to kind of reactivate the election. Essentially freeze the election as it is today, the date that you're voting on it, and then kind of unpausing when we get closer to the date. So that would allow the board to make a decision about 20 days in advance about the safety of holding the election. And it seems to me that at that time you can certainly schedule that to allow the town meeting to occur, before that. So I've been kind of suggesting to everyone that it's really one step at a time right now. I understand that the goal of addressing these issues is to ensure that the public has notice tonight that it shouldn't appear at town meeting, that it shouldn't expect the annual town election to go forward. And whatever we need to do to dot the i's and cross the t's, that kind of comes up because of the way that the governor and the state legislature is handling things, we'll be prepared to deal with that.
Did I answer your question, John?
I think so. It's the whole thing's concerning to me, but
Yeah, the whole thing is
I
concerning.
think I understand your
We don't know.
logic.
That's the
Yeah,
bottom
the
line.
uncertainty is what's
Right,
throwing me.
Right.
I have one thing to add to that, and I should have mentioned it, although it's not in front of me, is that we've historically, in the last several years, coordinated with the town of Hamilton in terms of elections, and so we don't know where they're coming from or what they've decided. And so prior to coming back to this board and suggesting a certain date, whether it's the 20 days or whatever, we would want to understand what Hamilton was going to do to continue to have the same, presumably the same elections on the same day.
Right.
For the reasons we have had in the past. So that, but that's, we don't know, we don't have any information from town of Hamilton right now. Even if we did, we still have to postpone this anyway.
They took a vote last night to postpone their town meeting and their elections.
But I don't know, we don't know subsequently what date they're going to choose.
Right.
That's
No,
my
we're going to have
point.
to
Right,
continue
yeah.
to coordinate. So just a question for Lauren. So I think, if I understood this correctly, you're saying that the motion that we're making tonight, which is essentially to postpone the annual town election until a date that we deem appropriate based on the circumstances, is all that we need to do for tonight?
Absolutely, and thank you for asking that question, Catherine. Yeah, I wanted to also point out that there's about 35 35 towns across the state that have elections and town meetings in the same, elections in the same period that you all do, and everyone is in the same boat. And so what we're, for towns that had, a couple of towns had elections yesterday, and we actually did go to court and get a court order to eliminate any concern about that, the postponement. But because we're not in that kind of an emergent situation today, and we expect that this legislation is going to be passed, this is really intended to provide notice to the public and to signal, to the voters that there will, that they should not come to town meeting, and they should not come out on the scheduled date for the annual town election, but that it will be postponed. And to the extent possible, I think it's very smart to do it in a way that's consistent with the way that you normally sequence those events.
So this is also putting pressure on the legislature to move on this action, as you're describing, or the governor.
I would say so, yes.
Okay, thank you. I think that settles it in my head.
Yeah, that was a motion.
Yeah.
Second,
Second?
further discussion?
No.
None.
All in favor?
Aye.
Thank you.
So we-
Thank you, Lauren.
We'll be, Lauren and I had a lengthy discussion about this late yesterday afternoon. We will need to republicize this frequently in the next month, both on the Wenham website as well as subsequent Board of Selectmen meetings, reminding people, by the way, for those of you who didn't tune in on March 17th, by the way, so I think that, Anthony, for the subsequent agendas, I think repeating the delay in the annual elections and the delay in the town meeting and put the warrant hearing in there as well. Even though it's no longer as well attended as it used to be in the past, nevertheless, that's an important date too. It's always the Monday before the town meeting, which now we don't know what day that is.
Yeah, I completely agree with you, Jack, and I think that, to your point as well, with the warrant, even the warrant hearing is going to take on more significance, because I think we're going to have to figure out a way to communicate the very somewhat complicated, not the ballot question issues. We're going to have to figure out how to communicate those as close to the time of the town election and but thoroughly enough. So the warrant hearing may take on a special importance this year as well.
More challenging the point is, more challenging this year than it had been in the recent past anyway.
Yeah, so thank
So
you.
Anthony, I'm going to turn to you for F4 and 5.
Sure. So on 4, as I mentioned, that we declared on the last week on the 14th, 15th, that we really recommend that no non-essential board meetings, committee meetings be held during this point, going forward, for the time being anyways. We still, as you can see, we struggled through tonight with Zoom on our first shot, and I know that we're not the only community that struggled through a meeting like this.
I think you need some practice sessions, before the next one.
Yeah.
I think we really do have an internet issue. I mean, that much of what we had problems with was connectivity.
Yeah.
So I don't know if we can address that or not, but anyway.
So I'd
Go ahead.
recommend that, that the board also just enforce that, or recommend to other boards that, unless they feel that's something essential, and however you want to determine what essential is through what mechanisms, whether that goes through you or me or,
I think that, the Board of Selectmen could determine what the Board of Selectmen agenda is, what we're going to do. I think these boards, whether they're elected or appointed, the chairmans, that we don't actually control. We can simply let them know what we're doing and what we would hope they would do, but I don't think we have any authority to look at their agendas as not important and don't meet over it. I think that's going way too far in terms of stepping at people's toes. Everybody understands what's going on, and I think that
Yeah, these are appointed boards and elected boards, and
Yeah,
we
both.
should not be, as you said, stepping on their toes.
Yeah, and so
without
it's
their-
up to them to just a minute, it's up to them to determine if they really need to meet or not. And some people think they need to meet every month regardless of the severity or the weight of the agenda, and others have different opinions. And so I think that I don't want to really, as one person, I don't want to weigh in on what they think is important is not. Jackie, you wanted to say something?
Yes, Mr. Chairman. I just wanted to let you know something that both, we've been working with the Hamilton Board of Health as well as the Wenham Board of Health in response to the COVID-19 virus, and I do want to let you know that both the chairman of the Hamilton and the chairman of the Wenham Board of Health did encourage this recommendation to the fellow boards and committees, fully recognizing that as chairs of appointed and elected boards, they get to set their agendas, but the chairman of our Board of Health did want to reiterate the recommendation of social distancing and doing remote meetings when you have business that you can't put off. So he did want to, I just want to reiterate that is an important part of the response to this virus is the social distancing, which as we learned tonight, the meeting can be a challenge because of internet. I will say I was on a Zoom call like this with over 100 people on Sunday, and everyone was electronic, and it was much easier than having this online/offline component the way we are tonight. But I would be remiss if I didn't reiterate Dr. Chang's desire for us to really recommend folks practice social distancing, including for their committee meetings.
I think we've heard social distancing 15 times a day for the last week,
Well-
but so I think we could,
Chairman,
just a minute.
Mr. Chairman, I'm sorry to interrupt. I want to wave my hand, but
Go ahead,
would it be okay to say something?
wave your hand. No, go ahead, yes. go
Thank you.
ahead.
I did, I waved. So
There you are.
I do think that the recommendation for only essential meetings be something that's really considered important. And perhaps the recommendation, instead of being about perhaps the approval rather than being about what the content is or whether the administrator believes that it's essential, is to ensure that there is a use of remote access like some of us are doing tonight for those meetings. Essentially, and I recognize the concerns of the town when it comes to kind of judging what meetings should and shouldn't go forward, but I think we have to balance that right now with the knowledge that even the President of the United States has recommended that there be less than 10 people gathering together at any time. And so, if the motion maybe was changed to say that, postponed until further notice, unless, working with the town administrator, they're able to provide for remote access for all participants.
You have something to say
Something
about
like that.
Do I?
Do you have something?
I do.
Go ahead, please.
So I was going to say some version of what Lauren said, although I agree that we don't have authority over those boards and committees. I think, just as we are looking to, and this is not a real fair comparison, but as we are looking to our governor to set guidelines for the executive branch that he's recommending everybody else follow, I think that boards and committees are looking to this Board of Selectmen to recommend, we can't mandate, but to recommend that non-essential public board meetings be postponed or, worked out remotely. And the only exception I can think to that would be meetings that have statutory requirements for being held, public hearings, land use hearings that have started and have end dates.
ZBA meetings?
Yeah, so I think, there's no question that those most likely have to happen, but I think to this recommendation is that only those essential ones happen, and they...
Which is the basis of my comments. I don't know what the ZBA agenda is, the Historic District Commission agenda is, and so that, we can encourage, I think, we can ask Anthony to send a memo encouraging them to, minimize the meetings, and if they do so electronically, but that would be encouraging them to do so. But, I don't think I want to be in a position to vote that we mandate anything, and because I don't think we have the authority to mandate it.
But this isn't mandating, this is encouraging.
That's the word I just used.
Right, and I think that we can mandate that the meeting, due to all of this emergency, declarations, I think that we can mandate that meetings, even ones that are essential, be done electronically or remotely to ensure that we have the social distancing. A ZBA hearing, it's as simple as if there are two hearings going on at the same time, they're scheduled in the evening so that one group comes and then another. There just are some guidelines that I think our town administrator can help work with those boards.
I question micromanaging other departments, other boards.
It's our responsibility to make sure that...
I understand that.
And
I understood that before I came into this meeting today.
Right. So all I'm suggesting is...
They have agendas and they have responsibilities that we're not overly familiar with, or may not be, or issues that come to their plate that they may have to deal with. And I think it would be not respectful to those boards to not allow them the leeway to come and look for some reprieve because they have an issue or issues that need to be dealt with.
So I'm not suggesting that. I'm saying that people need to think very carefully if, A, they have a meeting that does not have an issue that requires an action and can be postponed, and secondly, if there's a meeting that does require action, that they're very sensitive and cognizant of the fact that there is an emergency order saying that more than 10 people should not congregate together, and that there are electronic means to have the meeting.
And haven't we done that 3 ways to Sunday already?
Not relative to boards and committees.
Doesn't that say so up here?
That's very strong, and I would not, you're not going to get my vote on this one, which is be postponed in addition to meetings be approved by the town administrator. No.
It's a really big emergency. I guess I can't, and I know that you understand that, but I don't want to take on powers that we don't have.
That's what we're doing right here.
But we're in a situation where we can't necessarily rely on every chairperson to completely understand even the day-to-day things that might be changing. So if we make a general comment that if you're unsure, that please just coordinate with the town administrator. Some of these have staff, because they're going to have to anyway if they're going to do this electronically. Most meetings that are going to be done on Zoom or anything else are going to have to coordinate that with town hall. So,
Mr. Chair, may I just jump in here quickly? I'm sorry.
Hold on, Lauren.
Lauren, please, hold on. This is the debate amongst the three of us right now. So that encouraging, having Anthony come out with some memo to the boards, advisory, simply saying the essence of what we talked about, and that please minimize the meetings if it's not essential, et cetera, and that to be done electronically as opposed to in person. Remember the gathering of more than 10 people, so on and so forth. All of that I'm in favor of. Having approval authority over whether the chairman of the committee thinks it's important enough to have is definitely, I think, a step too far, and that I don't think that's, some of these people have hotly contested issues, and that we may not think that they're as important, but they do, and the people who are applying to the boards for relief or something certainly do, and that I can think of a couple, I'm not going to name them, but I think it's that's why we have we appoint boards and they appoint chairman, and that's, anyway, I'm babbling on. So I don't think that, I'm not comfortable dictating to them what they think is important and what isn't. And our review, Anthony's review of what's important and not. Because I don't know I don't follow all of these boards, and that I'm not sure I understand as a selectman, and Anthony does, the level of interest people who are applying for these permits and reliefs and so forth feel about it, and that I wouldn't want to get a nasty email saying, what do you mean it's not that important? Anthony says you can postpone it for a couple of months. It's going way beyond what I think we should do.
Well, I guess, though, we really, I think, as a society and as a town, are beyond level of interest that a board or committee has in a particular issue. There are certainly legal ramifications. Again, I'll use a ZBA hearing. If there's one that started, and Lauren could correct me if I'm wrong, but I'm pretty sure that you have to take certain actions by certain days, or you're going to be in violation of some kind of a permit. And so that's a statutory situation. But for any board to say, well, this guy really wants to get this blah 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 done by such and such, so let's take on a new hearing. I just think that that's irresponsible, and that we have a role as the executive. This may be a little too strong, but that certainly we should play a strong role in making sure that what we've said needs to happen and what the state says needs to happen happens, and especially things that happen in this building, which is where all the meetings are.
We better apply that rules to ourselves first, then.
Well, that's absolutely true. That's absolutely true. And if someone has a meeting that is less than 10 people that they think is very important, I'm not interested in getting in their way. But the fact is that even this meeting tonight, future selectmen's meetings, I hope that we can all participate remotely, so none of us have to be sitting in the room and creating extra work for the staff. But, again.
Well, you and John were invited to participate remotely tonight, and you chose to show up in person.
Well, yes.
That was a choice you made.
Quite frankly, since two of my two fellow selectmen were going to be here in person, it seemed like the right thing to do to be here myself.
I told her I had to come, so I mean, that.
Anyway, and this is the first meeting where we're talking about a lot of really difficult topics. They're hard to talk about, and.
Lauren raised her hand.
Okay.
I know, but we're still talking.
Yeah, so I think they're difficult topics, and I'm really glad, despite the risk, hopefully we've mitigated the risk, but I'm glad to be face-to-face for this meeting, because I think they're hard things to talk about. And these,
In fact, most meetings are. There's usually an agenda item or two that we have significant discussion and sometimes disagreement. So this isn't a piece of cake every time we have a meeting.
But I guess, I don't want to belabor this. It's not whether we disagree. It's more an issue of national health. So if there's an issue that's coming up that may be contentious, that doesn't mean that we should have it. If it's not something that has to be acted on. That's all I'm saying.
And we've delayed several of these on this agenda right now.
Appropriately. But
Right.
I guess this is just, sort of, maybe not in that wording, but is extending this recommendation strongly to other boards and committees. That's all that.
Extending a recommendation of the boards and committee, I'm fine with.
Right. I agree with that.
Mandating something, no.
Okay. So if we're done, I can see Lauren's hand waving from here. If we're done, are you okay, Mr. Chair?
Waving.
No, she didn't. She's got that expectant face.
All right,
Is that
Lauren.
okay, Jack? Okay.
Okay, now to put it up there.
Lauren, go ahead.
I almost gave up, and not speaking, that's a hard thing to do. This remote conferencing, this is tough.
Yeah.
I wanted to just kind of bring this back to a little bit of a practical application. And the first thing is that every time that meetings are held, the town hall has already been closed to the public as far as I understand. Is that correct, Anthony?
That's correct.
Yeah, and so the idea is that the less exposure that town hall staff and townspeople have to each other, likely the better. I think this is one of those cases where we're not going to be able to see the results of what we're doing right, but we might be able to, we might have to, unfortunately see the results of what we're doing wrong. I had read this motion a little bit differently than the way that you guys have understood it. to me, it said that meetings that were deemed to be essential would essentially be coordinated with the town administrator. I think that coordination is especially important right now. One, to make sure we have the staff to do it. Two, to make sure we have the disinfectant and hand sanitizer and, you know, the social distancing that's required. And then lastly, anytime we're taking staff away from dealing with things that are truly emergent, we're making it harder for the core staff to get done what they need to get done. So I will say I think a lot of cities and towns are going in this direction where they're saying, at least for the time period that the schools are closed and the CDC recommendations are, 25 or 10 or whatever they are today, that there be an effort to reduce the need for public gatherings and whether they're large or small. So I think, as I said a couple minutes ago, and that I'll promise I'll stop talking, I think that there is there's a real public health and safety reason to require coordination. And the message from the selectmen is, and I agree that it is something that you guys need to think about too. What has to be done versus what would we do if we had the luxury of time? And right now, I think we just don't, and it's hard to shift into a mindset where we're not able to do the things that we all find valuable and important. And I think it's going to be a burden on us, at least for the next 3 weeks, to try and coordinate the provision of town service and involvement of townspeople. And you guys are doing a great job. And, I think tonight is a good example of a first step, and closing the building, is another really important step. So, I think you're doing a great job. I think you're making decisions that are in line with the municipalities around you, and that are consistent with the recommendations of both the governor and the CDC. So I think, if maybe you change the word approved to coordinated, then perhaps
That's what I was about to say, is that I think everybody is pretty much on the same page as far as the need for serious contemplation when we do meet or have interaction with each other. But approval versus coordinated is a very big difference.
So if we change the motion to the last sentence to say, those meetings of boards and committees deem essential be coordinated through the town administrator, does that work better?
Better?
The first sentence is merely a recommendation.
I saw that again.
Recommends, and that those meetings that, to your point, Jack, that the chairs think are important or essential, that they just be coordinated through the town administrator so that.
I go along with that.
Okay.
Mr. Chairman, I neglected to say something that I think is important for this conversation as well. I apologize. But the requirements of the open meeting law, the way that they have been altered by the governor's order, really do require a thorough understanding of the regular open meeting law, plus this, this loosening of certain provisions. The loosening of certain provisions, though, kind of made the public participation through an online streaming service or something similar really important. And so that really does have to be coordinated before meetings can be held. My concern, of course, for every city and town is that they're going to be inundated with open meeting law complaints. So I think it makes sense to kind of have a protocol in place for that. And Anthony, I'm happy to share something with you so that you have a place to start in working on that. The other thing is that we have been encouraging all quasi-adjudicatory boards where there are ongoing public hearings to request an extension of 90 days if possible. I think like there was with the Permanent Extension Act several years ago, that there will likely be a Permanent Extension Act. I don't know when it's going to happen, but it's very hard to participate as an individual, if you're not skilled with the online service. And so the idea of the public hearing is that anybody who wants to can attend and be heard. And so, to the extent that we minimize the potential that we're excluding anyone from the process, that's probably better. So I think like you were all saying, whether something requires immediate action should be looked at on a case-by-case basis. And I'm sure you guys have done this as well, but a lot of boards and committees, they've worked together to kind of prioritize where things are and set up, a tick list, a tracker to say, okay, well, what has to be dealt with, what can be dealt with, what shouldn't be dealt with. And the has to be dealt with are the ones that you make the arrangements for the online participation. The ones that, don't require action right now in theory, especially because there's, developments in terms of the way that work is being undertaken, that those you ask for an extension, you continue whatever it is, the public hearing, the time to open the public hearing, the time to close the public hearing, or the time for filing a decision with the clerk. We have found that applicants understand that towns are dealing with a lot, and that there's just so many people and so much time to do the work that needs to be done. So, I think if you change the word to coordinated, you'll really be addressing all of those issues, and Anthony can, try to come up with a protocol to help people, make that kind of prioritization and make sure that they understand how to hold the meeting without taking the chance of violating the open meeting law, which also, in the case of hearings, can lead to due process challenges, which are more expensive typically than open meeting law challenge. I'll stop talking now.
I have two more comments. One, I think that, approved to coordinate, I think that's the word, I would go along with that. I think there should be an expiration on this of, say, April 30th. I think this coronavirus thing could be well into July and August. And that I think we need to revisit this to find out what problems we might have caused ourselves or not, or what bad feelings we might have caused or not. So I think.
So you're saying a time limit to what?
April 30th.
Postponed until, instead of saying it postponed until further notice, postponed until April 30th for reconsideration.
Yes. And if it's working fine and the chairman's all doing things and Anthony can report back to this group that, the people are really playing ball with this and they're canceling meetings and except for one committee, whatever that might be, or two, they're fine. It's working and that there's no hard feelings. If there is, it's been dealt with. But I don't know what, without an expiration date in here, we'd have to.
Sure.
I don't know what animal we're creating.
Right, that makes sense.
We don't want to box ourselves into a corner or the...
I want to be able to reverse or
boards.
modify if the circumstances require it.
Right, and have a date by which it kind of forces us to think about it and modify it.
Anthony can say, okay, how did it go? If we have a meeting on April 27th, whatever day it is, if we're still,
because I think you're right. It's going to go on.
Fine, there's no problem. Let's extend it, maybe with a modification or not. I don't know.
So the motion would be to recommend the non-essential public board meetings be postponed until
further notice.
And the meetings that boards, committees deem essential be coordinated through the town administrator through April 20th? April 30th?
This recommendation expires, April 30th.
Okay.
This directive to the other thing expires on April 30th to be reconsidered at that time.
This will be reconsidered and, okay. Is that?
I agree. I go along with that.
Okay. Do you have?
That was hard.
Do you have a motion?
I do. You do mean April 30th, 2020, right?
Of course, yes.
Hopefully, yes.
Exactly.
Yes. I personally, from everything I read, and I spent a lot of time reading about this, and we could be July and August.
We could.
And that,
Hard to know.
Hard to know.
Maybe we'll have a little more clarity by April 30th, but not necessarily. Okay. So we have, I guess, an amended motion, right, Jack?
We have an amended motion, which we've all cobbled together. So do I hear a second?
Second.
All in favor?
Aye.
Aye.
Okay.
So okay.
Catherine Tinsley, would you just circulate an email to the three selectmen tomorrow with Anthony, I guess, exactly what the wording is to make sure we all agree that this is exactly what we voted on tonight?
Will you read it right now?
Yeah.
Sure.
So it says the Board of Selectmen voted unanimously to recommend that non-essential public board and committee meetings be postponed until further notice. In addition, those meetings that board and committees deemed essential be coordinated through the town administrator. This directive expires April 30th, 2020, to be reconsidered at this time.
Sound good? Okay.
It's important,
Yeah.
if one word could, be,
Yeah,
okay.
okay.
Let's see what else we got here. I deem the rest of this agenda non-essential.
I don't know, Anthony might disagree with you on number 5. I don't know, since I don't know what exactly it is, but I feel
What we're
like,
doing is, right now, we're still working on, Nikki's been really working with Microsport Group on remote access for staff in the event that the building is closed and we end up needing to be quarantined for whatever reason. So that process is still going on, just letting the folks know at home that, we're here right now, we're still working, and even in the event that if we weren't here, we're still gonna be working.
So Anthony, I think we should pass over G. Anything on that?
Yeah, that's my recommendation
Yeah,
on G.
okay, I'm going to pass over that. And so I move that Board of Selectmen be adjourned as of 8:11.
Second.
All in favor? Aye.
aye.
Aye.